Good evening and welcome everyone. Thank you for taking time out this evening to join us for the webinar titled What is Neutralizing Antibody Rapid Tests? Neutralizing antibodies have come under the spotlight recently with various healthcare organizations offering tests and even appearing in recent news with regards to its applicability. There are 3 approved RTKs, if I'm not mistaken at this moment, and multiple quantitative assays listed for use by MDA. Our aim today is to look at current research and to enable you to make informed decisions when it comes to NAB tests. So just before we start, a little bit of administratives. We encourage you to mute your mics, to keep your volumes up, and during the webinar at any point whatsoever, you're welcome to input questions into the chat function, and we will answer these questions later. This will be a approximately 40-minute educational webinar with Q&A for the remainder of the hour. So let's begin. I'm your host and your speaker for today. My name is Tiffany. I'm a registered pharmacist and currently in business development with Sinotex. I obtained my Bachelor's of Pharmacy degree at Taylor's University and have exposure in the clinical, retail, corporate, and industrial pharmaceutical sectors in the past. Prior to Sinotex, I was with a generic pharmaceutical manufacturer where I successfully led multiple critical quality improvement projects. My previous roles granted knowledge and experience in quality assurance, pharmaceutical production, and warehousing within the ISO and GMP certified environment. We will then have Dr. Yaman for a Q&A session. Dr. Yaman is an assistant professor of clinical pharmacy and is currently the director at HWGB Biotech. He obtained his PhD in clinical pharmacy at University Science Malaysia in 2013 and possesses 7 years of experience in the academia, specifically in the pharmacotherapy field. He's actively involved in medical research and has published more than 40 SUOPUS ISI index research papers and has supervised more than 50 research projects. He's also serving as an editorial board member of several reputable international journals and has been a member of multiple international professional bodies. A little bit about our company. Sinotex is a forward-thinking company that offers innovative range of cold chain visibility, environmental and clean room monitoring, and temperature-controlled packaging solutions, mainly to the pharmaceutical, life science, biotech, healthcare, medical, and food industries. Headquartered in Malaysia, we have expanded our foothold to Thailand and Indonesia in order to confront diverse challenges in our industry. HWGB Biotech is a subsidiary of Hoa Genting Berhad. They aim to provide a comprehensive range of medical devices and health products that adopts a preventive measure and treatment readily available to improve the livelihood of Malaysians. Backed by a panel of experienced consultants with relevant experience in the healthcare and technology industry in regards to matters involving healthcare and biotechnology. Before we start, a few disclaimers that are important to note. All information in this webinar is provided for informational purposes and does not supersede your healthcare provider's advice. Please consult your healthcare professional for testing, interpretation of results, and diagnosis. We strongly caution individuals against using the results from any test whatsoever as an indication to stop taking precautionary steps to protect themselves and others. All data and statistics are based on publicly available data at the time of this presentation, and images in this presentation are for illustration purposes. Our audience are from a wide range of fields, each with their own expertise. At this point, please feel free to drop your questions in the chat box so that we can all learn together from it. All right, so how does our body fight off viruses? It's a very complex process. The immune response involves multiple types of cells. 2 major mechanisms are the innate immunity and adaptive immunity. The innate immunity is a non-specific defense mechanism that comes into play immediately or within hours of an antigen's appearance in the body. On the other hand, the adaptive immunity develops over a lifetime of contact with pathogens as well as vaccines, which help our immune system to distinguish friend from foe. So basically, the adaptive immunity is the one with a memory. If you were to look at the antibody concentration curve in blood, you can see at the point of the first exposure to antigen, there will be a increase in antibody concentration. The secondary response occurs when a second exposure occurs with the same pathogen. So if you can see the curve, upon the second exposure of the same pathogen, this elicits a more rapid and stronger response, raising the antibody levels above the previous peak. So this also explains how and why the second dose of vaccine is required. So we hear a lot about antibodies, but what are antibodies really? Antibodies is a Y-shaped protein that's produced by white blood cells. It is created to recognize pathogens, which are substances that causes immune response. This antibodies binds to recognize antigens, alerting the immune system. The immune system then sends white blood cells to destroy the present pathogen. Based on recent studies, there's a fun fact, the body has a potential to make quintillion, or in other words, 1 million trillion unique antibodies. So when it comes to antibodies, you may wonder if there are different types of antibodies. Yes, there is. In a normal occurrence, a virus would land onto a protein attached to the human cell. So this works somewhat like a lock and key concept, where if the virus fits this protein receptor on the human cell, it will open the door of the cell to enable the virus to enter into the cell. This is when the trouble begins because the virus can then replicate. So we look at an antibody called the binding antibody, or rather non-neutralizing antibodies. For these antibodies, they actually bind to parts other than that which facilitates the entry into cells. So if you can see the diagram here, the antibody is bonded to a protein located on the body of the virus instead of the spike, which elicits or rather enables entry into the cell. Whereas there are another type of antibody called the neutralizing antibodies. So these neutralizing antibodies binds to functional spikes or parts that facilitate the entry of the virus into the cells. So these antibodies actually prevent pathogens from evading into the human cell, as well as it is capable of destroying the virus. Therefore, it is called the neutralizing antibody because it somewhat neutralizes the effect of the virus. And it is a known fact in studies that neutralizing antibodies correlates with protection from viral infection. So if you were to talk about this in aspect of the COVID virus, the COVID-19 neutralizing antibody binds to the spike protein receptor binding domain, which is located in the spike protein in the COVID virus, preventing the virus from binding to ACE2 receptors on human cells. Thus, it prevents the virus from entering into the human cells where they can replicate and cause an infection. Some intended users, or rather suggested users of the neutralizing antibody, would be to test for immunity. So the neutralizing antibodies may be used to assess of vaccine effectiveness, and it checks on the body's response to vaccination or potential immunity. Secondly, the detection of past infection. So it enables, if a person has been infected by COVID prior, and has recovered, likely neutralizing antibodies will be present. Therefore, you'll be able to identify if a person has previously been infected and have recovered. Approximately 25% of infections are asymptomatic throughout the course of the infection. Thirdly, there is also a possible identification of hotspots and low immunity communities for improved management and following that resource allocation with the use of neutralizing antibody tests. It also complements the PCR test to aid in clinical assessment. and also identifying donor convalescence plasma. Convalescence plasma therapy is basically using blood from individuals who have already recovered from the virus to treat existing patients. The NAB test enables possible convalescence plasma identification for potential convalescence plasma therapy. So I'm sure you have heard of multiple brands, multiple types of neutralizing antibody tests. The two main types are categorized under qualitative tests, which are rapid test kits, RTKs in other words, and quantitative tests, which two of which are ELISA and CLIA. For qualitative tests, the results are merely whether it is a positive test or a negative result. And they are very quick. The results come up within 10 to 15 minutes averagely. And it requires a prick of a finger for finger prick blood, similar to, say, testing for a blood glucose level. There is no need for any equipment or laboratory, or rather, rarely there are preservation and transfer of samples because these are normally intended for use immediately. And it also has a benefit of accessibility where, because there is no requirement for a laboratory to perform this test, it can be done anywhere at any time. For quantitative tests, instead, the results come out in specific quantities, or rather some in ranges. Results requires hours to, could be a day or two, depending on how the lab performs it. And it also requires drawn blood. With quantitative tests, you may want to consider the need for sample preservation as well as transportation of the samples to the lab. It definitely requires a trained personnel to perform the test. And some may require, most require a laboratory setting, and some may require biosafety level 3 laboratory as well. So looking at RTK test procedures, they are actually performed very simply with 4 steps. First off, the individual's finger will be pricked and blood will be drawn by a dropper. This drop of blood will be applied to the sample well on the test kit, followed by a drop of a diluent. And pretty much that's about it. You will have to wait for about 15 minutes or so for the results to turn up. So it's a simple four-step or so process. So bear with me on this slide. It gets a little bit more complicated. I'm going to explain to you how the RTKs work. So the sample well here is illustrated by the circle here. And the T on the test kit is represented by the T line, following by the C line. So on each of this line, they are proteins as well as anti-label antibody, recombinant anti-label antibodies affixed on these areas of the test kit, as well as proteins just after this, between the window and the sample well. So when a drop of blood is applied to the sample well, if NAB is present in the sample, it will form a complex with the proteins located here, as you can see. The complex will move along the strip due to chromatography, and it will bind to the proteins located on the T line if there was a complex formed with the NAB. However, the complexes without the NAB attached to it will continue to move along the strip due to chromatography, and it will bind to the recombinant anti-label antibody on the C line here, as you can see, resulting in a red line. So in other words, the T line may or may not be present depending on the presence of NAB. If there is no NAB, which means there is no complex formed with these proteins, it will all move up to the C line and only cause a red line at the C line. When it comes to a result interpretation for the RTK, it's fairly simple. The first thing that you need to check is whether there is a line on the C line. All tests must have a line on the C line. If there is no red line at the C line, the test would be invalid, regardless whether there is a red line at the T line or not. So as for positive tests, you would see a red line at the T line and C line both, and negative would have an absence of the red line at the T line, which indicates the individual does not have NABs. We would also like to highlight that more often than not, the T line will actually be quite faint. This still indicates a positive result. Some key considerations to look at when considering purchase of the NAB would be a validation and quality tests. So we would like to highlight that serology testing is a powerful way to monitor the progression of the pandemic. However, in order to accurately use serology, extensive validation is needed in these test kits. Many of the available tests are of dubious quality, where especially the low specificity is of a concern. Reliable manufacturers should definitely have validation data available for you to view. We recommend tests to be tested by the Institute of Medical Research, Malaysia, and approved for use by the Malaysian Medical Device Authority, MDA. When it comes to accuracy of the test, a few points to look at is the limit of detection, sensitivity, as well as specificity. So these ranges here are the WHO recommended ranges for sensitivity and specificity for any rapid test kits. Also consider the acceptability of the test procedure. So in other words, for the rapid test kit, it's a simple prick of finger. For quantitative tests, we'll actually need to draw blood from the patient or the individual. Consider also clear and easily interpreted results for more accurate outcomes. And also consider the period and logistics when it's involved with these kits. Quicker tests will enable, of course, quicker turnover of tested individuals. And you may not, for the rapid test kit, you may not need preservation of samples, may not also need to worry about transfer of these samples. Right, so when considering rapid test kits, common terms that you may come across is sensitivity and specificity. So it's important to understand the meaning of these terms and identify their significance when selecting a NAB RTK. Do note though that all tests have some limitations, of course. So looking at specificity first. This is the ability of a test to correctly identify individuals without NAB and with fewer false positive results. In other terms, it means that if you have a person that actually does not have NAB present, the test is able to detect a negative result. False positive means that results which are actually negative but appears positive in the test. Sensitivity, on the other hand, is for the test to correctly identify individuals with NAB with fewer false negative results. So false negative results means that the test, they are actually positive, but it appears negative in the test. So the presence of NAB would be a positive NAB test result. Indicates an individual may be immune to the virus. Therefore, it is crucial that the RTK generates fewer false positive results where there are fewer occurrences where the test indicates the person has NAB present, but in fact the NAB is absent. So this is the danger. Hence, specificity is a vital factor to consider when you're looking at NAB test kits. Other than that, you would also like to consider sample size. So specificity and sensitivity are affected by the sample size used in a study. So as mentioned before, validation data by the manufacturer should be available, and we want to look at the sample size available there that they have been used. So in other words, sample size, a smaller sample size will result in a larger jump in percentage. For example, if I were to have 1% out of 100 individuals tested that tested positive, I will have a 1% result. But if I were to drop my sample size to only 50 individuals being tested, if I were to have one sample positive, that will result in a 2% result. Also, to look at is the limit of detection of these rapid test kits. This indicates the minimum quantity of NAB required for the kit to be able to detect a result, basically. Cross-reactivity is also something you may want to look at. The test kit should be validated to affirm no significant cross-reactivity or interference with other pathogenic microorganisms, and to ensure that the test specifically detects coronaviruses and is not detecting some other pathogen that is present in the blood. Right, so now we will look into the basic structure of the COVID virus. There are four major proteins, which is the spike protein, nucleocapsid protein, membrane protein, as well as the envelope protein. So commonly we see a lot of news about the spike protein. Nucleocapsid protein is gaining traction now. In the natural infection, our immune system actually recognizes all of these proteins to varying degrees. The N protein and S protein are the most immunogenic, which means the S and N protein has the most ability to provoke an immune response in the body. Most vaccines are currently developed to introduce spike proteins, as you can see in the table below here. So these are all the vaccines that are available or about to be available in Malaysia. So if you look at this table, whether it's a natural infection or the vaccines, all of them have the presence of spike proteins, which means your body would definitely be developing neutralizing antibodies for spike proteins. In vaccines such as Sinovac and Sinopharm, where whole viruses are introduced, there will be neutralizing antibodies generated for N proteins as well as M and E as well. So NABs for nucleocapsid protein are less commonly tested. In fact, at this current moment, to my knowledge, I do not know of any tests that are doing NAB RTKs that are measuring for nucleocapsid proteins, NABs for nucleocapsid proteins. Now we look at the spike protein. So S protein or spike protein enables receptor binding. So virus replication only happens inside the cell. The spike proteins initiate the cell invasion, therefore the likely targets of NABs. And also in turn regarded the most relevant protein to elicit crucial antibody response. NAB test identifies the NABs that bind to the spike protein. As I mentioned earlier, to spike protein, not the N protein. So the concept has always been to quickly tackle these S proteins in order to block the virus entry, thus preventing more virus to be made. If a person has antibodies that can recognize the spike protein, this should stop the virus in its tracks, theoretically speaking. So there are some variables and challenges when it comes to rapid test kits. NABs can vary in terms of their target viral protein, which is whether it's an S or N protein, and in turn, it varies in terms of the NAB it's measuring, whether it's measuring the NAB for S protein or for N protein. Validation sample size and LOD, a limit of detection, can also affect the performance of these rapid test kits. Individuals' antibody response to a particular antigen being tested also varies quite widely. Generally, it's recommended for this test to be performed 2 weeks post-vaccination or recovery. Because of this high variability between individuals, some individuals may require up to 3 to 4 weeks to be able to detect any neutralizing antibodies. Some tests also only use part of the S protein. This may also result in a selection bias. There is research that indicates the S protein have more similarity versus other proteins across different variants of coronaviruses, which increases the ability to detect NABs formed from different variants. The N protein is also known to be similar in this area to the S protein. So the burning question now is how much NABs is enough to confirm a person has immunity to the virus. As of now, unfortunately, there are no guidelines currently established because further research is required. There has been 2 researchers so far that I've known of, one from the University of New South Wales, Sydney, the other from University of Oxford, England. So the results currently available are still rather inconclusive. Even the study from the University of Oxford is currently still under peer review, so it is still, the process is still still ongoing. We are still trying to find out, researchers are still trying to find out the actual volume or amount of these neutralizing antibodies, which are sufficient and adequate for us to say that it is enough for immunity, for a person to have immunity against the virus. So some key takeaways that we have here at this current moment is that we know that NAB does correlate, amount of NAB does correlate to protection that a person may have, and can indicate previous infection. NABs can be tested qualitatively as well as quantitatively. And they may not actually be the only reason for protection. As I mentioned previously, there are many cells involved in your immune system. Therefore, the protection may actually come from different cells, and this is a currently highly researched topic at this moment. Some challenges that we have, though, is that there may be a lack of manufacturer-published validation data for these test kits. So it's important to actually request for this. There are also insufficient studies currently now with proper longitudinal studies. This means that there are insufficient researchers which the designs involve repeated observations of the same variables over a period of time. Most of the studies currently available are retrospective, meaning that it's summarized or concluded based on multiple studies previously done in the past. And they are also cross-sectional, meaning that it only looked at data from a population at one specific point of time or so. Also, low sample size is also an issue in previous studies, or rather studies that or summarized studies that we have at this moment. In addition to that, there's also a lack of harmonized tests. So these studies that have concluded tests from, or rather researchers from the past retrospectively, these retrospective tests have all been performed on various different kinds of neutralizing antibody tests. So therefore, when put together, it doesn't quite give you a very conclusive and complete, accurate result, because they're all done on different tests with different performance. Some things requiring further research would be, we still are yet to fully understand the antibody's response to the virus. And also, of course, the level of antibodies that we require for adequate protection. The degree and duration of our immunity is also not yet fully understood. To top that off, there are studies showing that there is a very high variation between individuals in terms of their degree of protection as well as the duration of how long these antibodies last in their bodies. We also need to find out the immune responses of asymptomatic cases. This is not fully understood yet. And of course, at the end of the day, lastly, the need of whether we do need booster shots or not. So ultimately, the presence of NABs does not mean 100% protection from contracting COVID-19. Therefore, we most definitely have to continue practicing all preventive measures. Whether you're tested positive or negative, these preventive measures should still be continued. NAB tests are not compulsory post-vaccination in Malaysia. All information in this document is provided for informational purposes and does not supersede any of your healthcare provider's advice. Please most definitely consult your healthcare professional for any testing that you need to do, interpretation of results, as well as diagnosis. There is a large quantity of studies currently being published. There's also a lot that we need to still learn. However, I'll come to the end of my presentation today. We can overcome this together, continue to practice precautionary steps, and protect yourself and others. We will now move on to the Q&A session with Dr. Yaman. Dr. Yaman, over to you. Thank you, everybody.